Institute of Dr. Mahapatra Arun Kumar Sir, Assistant Professor, All India Institute of Ayurveda, New Delhi. Now, with the kind permission of our organizing chairman, Dr. Nisha Oja Madam, may we start the event by invoking the blessings of Lord Dhanvantri. I also request Dr. Anju KP and Dr. Simi PG Scholars, Department of Kumar Vidya, to recite the Dhanvantri Vandana. Dr. Anju and Dr. Simi.
Shangam Chakram Jalungan Dadadamamridakadam Charudobis Chadurbihi Sukshma Sochadi Hridyam Shugapari Vilasan Maudimam Bhojanetram Kalam Bodho Jalangam Kaditada Vilasacharubidam Baradyam Vande Dhanvantarim tam Nikhilagadavan Praudada Vaknileelam.
Thank you, Dr. Anju and Dr. Simi. Moving on now, I am inviting our HOD, Dr. Nisha Oja Madam, to formally welcome all the guests and speakers to give a brief introduction of the webinar. So, Madam, please.
Thank you, Dr. Branda. A very good afternoon to all. Today, the Department of Kumar Vidya, National Institute of Ayurveda, Jaipur, is going to conduct a webinar on the occasion of POSHAN Ma and as a mark of Ayurveda Day. First of all, I would like to thank our Ministry of Ayush, Government of India, Padma Shri Vaidya Rajesh Kotecha, Honorable Secretary, Ministry of Ayush, Professor Sanjeev Sharma, Honorable Vice Chancellor, National Institute of Ayurveda, Jaipur, for giving us opportunity and support to conduct this webinar. At this outset, I welcome our esteemed speakers of today's webinar, Dr. Prashant Gupta, Associate Professor, Department of Kumar Vidya, All India Institute of Ayurveda, New Delhi, and Dr. Arun Mahapatra, Assistant Professor, Department of Kumar Vidya, All India Institute of Ayurveda, New Delhi. I also welcome all the learned audience who have joined the webinar. So today there are two occasions. One is today is our Prime Minister, Honorable Prime Minister's birthday, and the whole country is celebrating, and therefore this day is important for all of us. And his vision is also Suposhit Bharat, and we are just contributing in this his vision. And therefore, this day is important. And one more thing I would like to, on this occasion, I would like to announce that National Institute of Ayurveda has been declared as Center of Excellence for Nutrition by Ministry of Ayush, Government of India. So with this, I'm going to give a brief introduction of this webinar. And as we all know that the month of September is observed as POSHAN Ma as a part of the National POSHAN Abhiyaan since last 5 years. And today is this year is the 5th POSHAN Ma, and we all are mainly the Ministry of Child and Development, Women and Child Development is celebrating, and we all are also celebrating this POSHAN Ma as a part of POSHAN Abhiyaan, and which is a central government's initiative which aims to strengthen the efforts to end hunger and malnutrition. And in this 5th POSHAN Ma, the aim is to convert Jan Andolan into Jan Bhagidari to fulfill the Prime Minister's vision of Suposhit Bharat. And the central theme of POSHAN Ma 2022 is Mahila or Swasth and Bachcha and or Siksha. And this POSHAN Ma is celebrated as a part of POSHAN Abhiyaan, the central government's flagship program, which aims to improve the nutritional outcomes of children under 6 years, pregnant and lactating mothers. And as we know that nutrition is a critical part of health and development, and better nutrition is related to improved infant, child and maternal health, stronger immune systems, safe pregnancy and childbirth, lower risk of non-communicable diseases like such as diabetes, cardiovascular disease, and longevity. Healthy children learn better. People with adequate nutrition are more productive and can create opportunities to gradually break the cycles of poverty and hunger. And malnutrition in every form presents significant threats to human health And today the world faces a double burden of malnutrition that includes both undernutrition and overweight. Therefore, as we are a part of health system, we are trying to make some contribution in this POSHAN Abhiyaan through this webinar. Once again, I welcome you all. Welcome.
Thank you, madam, for this time and efforts you took to share your thought experience with us. First, I feel honored to have with us Dr. POSHAN Gupta sir, Associate Professor, All India Institute of Ayurveda, New Delhi, ex-faculty at UP and Chhattisgarh government. Sir has published more than 50 research articles and 3 books, chapters in various books and e-learning modules. 4 patents filed, out of them 2 obtained. Invited speaker in more than 20 workshop and seminar. Sir has DHR Winter Fellow 2018 Fellowship and INSA Visiting Scientist Fellowship 2019. Sir has conducted many research projects. Sir is National Secretary in Arogya Bharati, member in various committees related to Ministry of Ayush and Ministry of Women and Child Development. Now it's time to listen our speaker, Dr. POSHAN Gupta sir. I would like to call upon sir for share his knowledge on topic integrative approach for nutrition. Sir, please. Unmute yourself, sir.
Thank you very much, sir. Thank you very much, all of you. At the outset, I would like to congratulate the whole department, especially the head of the department, Mr. Nisha Oja madam, for conducting such a very beautiful webinar. And again, a congratulations for becoming COE for POSHAN, and that is a good news for all of us. So, I think I should start, sir.
Yes, sir. You may share your screen. Screen.
Is it visible? Is it visible?
Yes, sir.
Yes, sir. Okay. So, taking a part of nutrition, I'm going to discuss integrative approach for nutrition, which is basically a planned approach for combating nutrition. Means single pronged or a single facet approach towards nutrition would not work. That's what we learned in last 20 or 50 years. That in spite of all attempts, the nutrition and nutrition related issues has not coped up. So, starting with the Global Hunger Index 2000-2021, in India stands almost at 106 in a 3 digit, and the situation is serious. If we come on to the states, most affected states of the India are Bihar, Uttar Pradesh, Jharkhand, Meghalaya, Madhya Pradesh, Assam. These are the states which are basically more nutrition prone, deficiency prone, and some of the cities are obesity prone, although it's not visible here, but Delhi, Bangalore, Calcutta, these are the cities where we have ample food for our kids and the adults. So these cities are facing, nowadays they are facing an equal problem of malnutrition, that is called obesity. As our madam also told about that, we are in a transition where that malnutrition and obesity is both visible. So, taking a glimpse over what is malnutrition, it's a deficiency, it's an excess or an imbalance. And if we talk about the deficiency, it's underweight. Everybody knows. I'm not going to go into the details of deficiency. What is underweight? What is stunting? What is wasting? What is micronutrients deficiency? And the second one is excess. Excess is overweight, obesity, diet-related NCDs, heart disorder, stroke, diabetes, and cancer. And somewhere there is an imbalance. So some skin-related issues and some GI issues are also due to that imbalance. So the status of the world is something out of all babies, 42 million reported 42 million children are under the age of 5 years are overweight or obese, and 50 million are wasted or thin. So you can see that the situation is almost equal for obesity as well as for undernutrition, and 156 million children are in the stage of stunting. Some factors which we can visualize, they are called extrinsic factors. Actually, they are the treatable factors. So, gender inequality, literacy, socioeconomic status, infectious diseases, poor sanitation, cultural practices, environmental enteropathies, poor implementation of health, geographical conditions, poor coverage of health services, and these are some factors which we can nullify for getting a better nutrition. So India is a vast country, so the causes are also vast. If we go in north and see the Ladakh, so there are some other causes, and if we go in central India, Chhattisgarh, Madhya Pradesh, there are some different causes for same malnutrition issues. So talking about Madhya Pradesh, inadequate food and unhygiene environment, low breastfeeding rates, and if we talk about Uttar Pradesh, there is early discontinuation of breastfeeding. This is a practice, delayed complementary feeding, and misinformation from taboo. Bihar itself is a huge income disparity, drought and floods, poor health infrastructure, and surprisingly, the doctor population ratio is 1:43,000. And if we talk about Rajasthan, yes, there is scarcity of water, silicosis, migration is major cause for malnutrition. And if we talk about Chhattisgarh, where I served almost for 3 years, what we saw, there is ample rice, but the protein sources are less. Faulty food habits, and some taboos are also there. They used to take moringa, but when someone falls ill in Chhattisgarh, it is a misnomer or a casuistry that he or she should not take moringa. So this is at a time when the moringa is best required. Patients or the common population do not take that food. So such faulty food habits and taboos are some misnomers which we can eradicate through IC and or a multi-pronged approach. So these are some causes which I find that they should be discussed. The status is somewhere nearly 30 to 35% underweighting and nearly 30% stunting. Surprisingly, few of the cities have equal amount of obesity also. So we are in a transition of this nutritional transition of pattern 3, 4 and 5. So these are some big programs running throughout India which actually willing to cater the nutritional issues. There could be a POSHAN Maha which we are celebrating, POSHAN Vatikas, and they are also state specific. So in Rajasthan, what we find Mamta card, NCC, Sahyogini, food fortification project. While if you talk about Maharashtra, there is Atal Bal Arogya and POSHAN Mission, Right to Food campaign, Garib Kalyan Week. If you talk about Chhattisgarh, there is a POSHAN Abhiyaan, Vajan Tohar, Haat Bazaar, Chirayu Yojana, and all other yojanas which basically caters multi-pronged approach which we will discuss in the later slides. So how ministries are being involved? So if we talk about Ministry of Health and Family Welfare, what we find for to curb that malnutrition and malnutrition sequelae, there is a National Nutrition Anemia Prophylactic Program, National Prophylactic Programs for Prevention of Eye Blindness due to vitamin A deficiency. Ministry of Education is also giving midday meal program. Ministry of Social Welfare is also giving beautiful programs for applied nutritional programs. Here we learn the behavior also. Ministry of Rural Development also gives an ICDS, special nutritional programs, Balwadi nutritional programs. And in between that, Ministry of Ayush has also given some beautiful instructions, are taking a leap ahead for such curbing of that nutrition, and I'm happy to be part of that committee, which is actually looking after the collaboration of Ministry of Health and WCD, and I think NIA is a program management center or unit for that program. So Ministry of Ayush and WCD is also working on curbing that nutrition. Ministry of Ayush has given a very beautiful and very good document over POSHAN Mukt Bharat, and he discussed again an integrative approach of how that Ayush POSHAN should be attained. It is right time, quantity, quality, method and places. We all learned in our undergraduation, and this is the time where we should give it into the common man that what is time, and time is something fixed, means one should inculcate a habit of having meal on time, and time can vary one to one, but Shastra is given some precious time for food, that is called Kale Bhojana. Again, the quantity should be consumed optimally. That optimum sometimes is very much variable in given geography. So if you are feeling that the food is enough, and the baby usually do not justify the quantity, so we must justify the quantity by the age or by the weight. So component C is again easy to digest and pleasant to mind. Mental state during intake should be yes, with a due respect and a calm mind. It should not be using TV or mobile during eating, which is a common practice nowadays. It should be discouraged. And ingesting food calmly and neither too slowly nor too fast. Method and place is also been very good explained in Ayurveda. Proper hygiene, regional fruits and vegetables, and food articles in daily diet. Regimes, traditional food processing techniques should also be adopted and should be promoted. And using an iron utensils, preferably for cooking the food, except 4 items, that is also being advocated in that POSHAN Mukt Bharat dietary of the Ayush. So integrative approach should be like diet, behavior, mental care and therapy. We will discuss one by one all of these. So we did a very good project, a pilot project in Chhattisgarh, where we didn't change anything in the food. Whatever the student or the patient was or the baby was taking, we were not changing anything in that. We just added an appetizer before the main course, or 20 minutes before the main course, and that was ginger candy or a soft candy, whatever is available. We have given 300 patients for ginger and 300 to the soft candy. And then we didn't change the food and digester. So what we saw, that just by adding appetizer, the skin luster has been changed, and the weight is average in 30 days was 1.25 kg. So this is a way how we can change the nutrition or assimilation of the food, not by changing the food, but just by adding appetizer, applying a formula or a concept of Ayurveda. In another study, in 70 patient clinic study, where we used moringa and it was given with digester. So the 30 patients, those who are without a digester and were on only moringa, they got only 0.7 kg weight gain in 30 days. While those who given with digester, they got 0.9 kg. It's 200 grams, that is again a 23% rise in a without with digester, it is 23% rise in the weight. The weight was the sole criteria because it responds first, and the study was pilot, although we were in plan to take it in a wider range, but till date we have not completed that project. So maybe in next 6 months we would be able to give you better data whether the appetizer and digester can give synergism or not. So this is what actually we need to know, nutritional transition. there are five phases of nutrition transition where a common man goes or crosses these five patterns. We were actually knowing that we were hunter-gatherers, that is collecting food by their own, and it is a pattern one. Actually, India crosses that pattern. Then there was a early agriculture that was called a famine pattern, where we had only one type of agriculture, and again a labor intensive work was there, and India was in that stage in 1950 to 70 or 75. And then there was a pattern of third pattern, receding famine. That means we are getting good nutrition, on the verge of good nutrition, although the starch is more, low fat diet, high fiber, drinking was water only, and labor intensive. And then came a pattern 4 where we have a very good food, includes fat, sugar, processed food diet, drinking is turned into sugary beverages, juices, and technology was more used, so sedentary life was promoted. And then came a pattern 5. This paper was published in 2006 about nutritional transition, and that the author says that every country would go in these 5 patterns, maybe in a single time frame or in a multiple time frame. So pattern 5 is when someone realizes that I am going into a chronic disorder, it changes the behavior. That is a reduced refined carbs, sugar is reduced, unhealthy fat is reduced, fruits is increased, and the whole grain is increased in the food. Water again came into the low calorie beverages, and sedentary life is reduced. They are asking for the yoga and all other practices. So actually India is living in all these 3 patterns. Right now India is also having undernutrition, having some chronic illness due to that nutrition, and we have a population who seek that behavior change. Patients came to our OPD or our normal discussions like that, what yoga we should do, or how we can reduce our carbs, and how we can switch on to a healthy diet. So this is actually a behavioral change, and India is in a situation where all these 3 things are visible, and it's a responsibility of pediatrician that they should recognize which area is landing in which part, and which patient or a participant is coming from which pattern. So I have taken this cutting from some newspaper, which is actually a behavioral change, and just by doing some yogas like Shastasana, Chinmay Mudra, or Bandhakonasana, or many more, just to add appetite or a fire of the body, so that whatever you consume, it should be properly digested and assimilated. These are some Bal yogas which improves appetite, digestion, maintain fitness, boost growth, stress-free living, and obesity control. So we must also include yoga in our integrative approach for nutrition. And here comes a very important topic which I want to include in this nutrition, which is a digital nutrition. Nowadays what we saw, everything is fed by digital age. We are living in a digital age, so we should also talk about that how digital nutrition can work upon us. So digital nutrition is something which is positive and proactive, mindful and balanced, and practice and realistic utilization of digits in a human life. It's a future-focused approach where digital nutrition is about preventing problematic internet uses or over uses, and seek to proactively provide alternatives. This is actually a scope of a digital nutrition. What we saw, it is a mindful and emotional awareness towards utility of technology. It is importance of the balance by the way of using the technologies in the common man, and it is for all. It's for parents, students, educators, doctors, patients. What we saw, there is computer syndromes, computer vision, eye vision syndromes are very frequent, and tearing, excessive tearing, the dry of the eye is very common nowadays in our OPD. So we should also know what is digital nutrition and how we should behave. Sometimes there is screen time, usually patients ask to us. So it is, although the government of India, I am not sure whether they have released any digits for using the screen time to our pediatric age group. Although the US government has, OEO government has issued that 18 months and younger should not be exposed to the screen. 2 to 5 years, less than 1 hour of screen exposure, while 6+ holders are at the parent's discretion. So we should be more cautious about digital nutrition, so we should unplug if it is overplugging. What we saw yesterday, that one fellow who got at the knees and got second rank, and in the interview, what I find a very good line, and you can visualize the last line where he says social media or internet से दूरी बनाई या फिर उसे यूज करते रहे थे आप. So he replied very beautifully that पूरी तरह सोशल मीडिया या इंटरनेट से दूर नहीं था, लिमिटेड यूज करता था. जब भी लगता था कि पढ़ाई पर असर हो रहा है तो उसे इस्तेमाल कम कर देता था. मैंने YouTube से कई टॉपिक्स के ट्यूटोरियल वीडियो देखे, इससे मुझे काफी मदद मिली. दैट इज व्हाट एक्चुअली डिजिटल न्यूट्रिशन इज. Coming on to the fourth part, that is therapeutics. Therapeutics for in nutrition could be of two types: clinical nutrition. The second one is public health nutrition. The clinical nutrition is something where dealing with the physiological or pathological aspects of the nutrition, and public health is something which is common or fit for all. The branch of the human nutrition dealing with human health and the services necessary for maintaining human health. Just by using that therapeutic, the term which comes in my mind is POSHAN. If we can judiciously or if we can proactively produce POSHAN for public health nutrition or clinical nutrition, we can get very good results. And also, if we talk about POSHAN, we all know, I'm not going to going into the details, but I'm going to touch few of the points which we find very interesting to share. POSHAN is one of the type of a lehan which gives an they contains a swan, honey, ghee and herbal drugs in various combinations for desired effects like Ayush, Medya, Vivalivargana, all these things. And this is actually edict of POSHAN, where you can find in a lower picture, you can find there is a phosphorus, there is a magnesium, zinc is also there, aluminum is also there, calcium is also there, iron is also there. Along with AU, we find a cocktail of elements. So when we go into the minerals and vitamins deficiencies, POSHAN can act in a very good manner. Although the studies are very limited for POSHAN utility in nutritional or mineral deficiencies, but this cocktail can effectively prove beneficial for that curbing of that mineral based deficiency. Another term that is actually sequelae of malnutrition comes when there is an oxidative stress. So what we did, we compared the antioxidant property of 4 samples which actually were given in tissue and the caustic form of POSHAN, and what we find that sample A means simply POSHAN and ghee and honey are the most potent antioxidants in comparison to tannic acid 50% concentration. So I think as an antioxidant or to prevent the sequelae of nutrition, we can adopt this POSHAN. So yes, we did a tandem electron microscopy, tandem mass electron microscopy, and what we saw that the structure of the gold present in the minerals present in that POSHAN are not harmful to the GI and they can be easily absorbed. So this also is under publication, but this is a very beautiful, very interesting finding. Sometimes there is a question: why should we give in a newborn that Swanprasan? So if it is conducive, it is atmosphere to the GI of a newborn, we can say that it would not trigger any erosion or it would not trigger any maybe a colitis or enterocolitis or anything. So this is a finding which I was thinking to share with you. Sometimes people also say that the Swanprasan or your medicines may be harmful or having heavy metals. So we did ICP-AES and what we find that PB is in admissible limit and arsenic was nil in all of the portions. So it has ample iron, it has ample copper, it has ample gold, it has ample silicon. So these all 6 parameters we did for part per billion calculation and even in part per, sorry, it's not part per million, it is part per billion. ICP-AES gives part per billion. So part per billion also shows no arsenic and lead in a permissible limit. So the claiming that they should be cautiously used in neonatology or in a pediatric age, this is just a misnomer. We can use it. And where see, I just maybe it is out of context, but we checked the retention, entrapment, and release pattern of any drug. Here we took isoniazid and rifampicin with Swanprasan, and what we saw that Swanprasan can hold the isoniazid, can trap the isoniazid, and rifampicin can hold better than the plain gold nanoparticle, and they can have a retention in the sense it has a sustained release of drug. So if any drug or a therapeutic is to be given for that nutrition, Swanprasan can be given, can give as an adjuvant or can give as an add-on or a synergistic effect. So what we learned from that study, that if we give any nutrition or a therapeutic, maybe zinc or maybe any other therapeutic with Swanprasan, it can absorb better, it can give better time, better release in the GI in that 5.5 pH. It will have more time, so that co-transportation and active transportation of our glucose, of our elements would be better. So this is also under publication. So maybe in next 3-4 months we may have that publication. So what I am saying that what we think about co-nutrition is actually a part of nutrition. So just adding Swanprasan in anything can improve the nutritional status of a newborn, the infant or the pediatric. So I think this is all from my end. Hope I have taken my 30 minutes. 10 minutes are open for the session or maybe as per the directions of the organizers. I acknowledge Dr. Chandra Madam, Dr. All Institute of Ayurveda, Dr. Raju Pavadar, and Dr. Arun Kumar Mahapatra sir. I also acknowledge Dr. Nisha Oja Madam, Dr. B.D. Sharma ji, and the whole Commerce Department of Ayurveda. Thank you very much for patiently.
Thank you, sir, for simplification of this complex subject. That is integrated approach for the childhood nutrition. So, sir, very nicely you described all the things, especially the digital nutrition and the role of Swanprasan also in the nutrition.
Thank you very much.
Moving on to our next eminent and distinguished speaker, Dr. Mahapatra Arun Kumar sir, Assistant Professor, Department of Komarbitya, All India Institute of Ayurveda, New Delhi. Sir is honored with various awards like Himalaya Jivak Award, Dr. Tripti Mishra, Smriti Sansad Award, and many awards. Sir has published more than 50 research articles and 3 books. Sir has delivered many guest lectures and at various platforms. Member in various committees related to Ministry of Ayush and Ministry of Women and Child Development. Now it's time to listen our speaker, Dr. Mahapatra Arun Kumar sir. We welcome you, sir, to fulfill our knowledge with your precious thought on topic pediatric malnutrition prevention and nutritional improvement and Ayurvedic perspective. Sir, please.
Thank you, Dr. Brahmadatt, for such a nice introduction. First of all, respected Vice Chancellor Sir, Professor Sanjeev Sharma Sir, and my respected teacher Nisha Madam, Srinidhi Sir, Rakesh Sir, and Dr. Vishal and Brahmadatt. It's really a great opportunity for me on talking on this occasion of POSHAN Ma, because I did my PhD from National Institute of Ayurveda, Jaipur, and what I learned about malnutrition was from that institute only. So I still remember the days when Dr. B.D. Sharma and myself were going to the villages of Rajasthan and were visiting all the school children and taking their anthropometry. I learned the basics of all the fundamental principles of malnutrition from my mother institute, that is National Institute of Ayurveda, Jaipur. So thanks first of all for inviting me on this occasion of POSHAN Ma. So my presentation is visible?
Yes, yes, sir.
So I will be talking on the Ayurveda perspectives in the childhood malnutrition management. So as you all know that this malnutrition is really a very complex problem. So it is not only a work of clinician to manage a malnutrition. Rather, multiple components integratively can only manage this complex condition. So as you all know that malnutrition encompasses many of the dimensions, which includes undernutrition, overweight and obesity, and inadequate vitamins and minerals, and many other facets are there. So it is sometimes people synonymously take undernutrition and malnutrition as synonyms, but rather a malnutrition encompasses all the facets, include undernutrition, overnutrition, and inadequate micro and macronutrients. So as you see that malnutrition is just not a clinical issue. It's an intersection between food insecurity and health insecurities. And often it comes as a combination of many factors like inadequate household food supply or child care practices or improper access to health. So the situation, really to deal with malnutrition, you require a lot of multi-dimensional approach. You require a lot of expertise to really deal with malnutrition. So globally, everyone is trying to manage malnutrition, to eradicate malnutrition. But really what is the issue behind the things is that most of the research studies or the clinical aspects are dealing on the severe acute malnutrition, that is SAM. But most neglected form of malnutrition is the grade 1 and grade 2 type of malnutrition. So if we can take care of grade 1 and grade 2 malnutrition, it will further not deteriorate into grade 3 and grade 4, which are very difficult to manage. So the Ayush perspective, not only to manage the severe acute malnutrition, but also how can we take care of grade 1 malnutrition and grade 2 malnutrition. And most and foremost importance is how to take care of the mother, that is antenatal care, and the lactating mother, because direct maternal malnutrition will lead to the fetal IUGR, and further it will lead to the gravity of the malnutrition. So It is a comprehensive package for a clinician to deal with. So if you see the global statistics of 2020, about 149 million children under 5 years are estimated to be shunted, and 45 million are wasted, and about 38.9 million are overweight or obese. So you can see that the statistics are showing a very grave situation around us. So about if you say that undernutrition is associated with 45% of under 5 children. So WHO statistics says that undernutrition is associated with 45% of the under 5 child deaths. So Indian scenario is also not so different. It is also very grave. So if you see that undernutrition is among under 5-year children in India is a major health problem. So out of total world's undernourished children, 80% lives in 20 countries. In India, almost 60 million children are underweight. So regarding the etiology of undernutrition, because I will be discussing on the undernutrition part of the malnutrition. So if you think of the etiology of undernutrition, there is not only is one or single form of etiology. It is a multifactorial, multi-etiological aspects behind the malnutrition, starting from poor breastfeeding practices, delayed introduction of complementary foods, taboos and superstitions associated with food, frequent infections, poor access to healthcare facilities, gender discrimination, abnormal meal times, economical imbalances. So there are various types of etiological factors associated with undernutrition. So the clinician, particularly Ayurveda physician, who is always associated with the society at a very ground level, must be aware of all the factors before applying it clinically. So there are various types of factors associated in the etiology of malnutrition. So recently global hunger index was released, and the India score was 27.5, which denotes a very serious score. It is a serious situation that the level of hunger is very high in India. So India ranks 101st out of the 116 countries with sufficient data to calculate the 2021 scores. So if you can see, the India ranks 101 in this global hunger index. It is far behind Bangladesh, Pakistan, Nepal. So we are this is a very grave situation for all of us, that in 2022 we are still discussing about hunger and malnutrition. So we are Vishwaguru, and we want to excel in the future. So very immediately we have to eradicate this malnutrition from our society. So the National Family Health Survey 5, which shows the data from 2019 to 21, we see that there was about 30.1% of the children of urban areas and 37.3% from the rural areas are shunted. And similarly, 18.5 and 19.5 are wasted, and 7.6, 7.7% are severely wasted. So you can see that the incidence rate of this malnutrition is quite very high in urban as well as rural area. Similarly, anemia among children is through 64.2%, and in rural it is about 68.3%. So it's quite high. Similarly, another report, which is a very reputed report from the Ministry of Health and Family Welfare, that is Comprehensive National Nutritional Survey, it states that about 35% of Indian children aged 0 to 4 years were shunted, and 17% were wasted, and 33% were found to be underweight. So if you see that, it is really a very grave situation. But Government of India is very strongly committed to achieve the 2030 Sustainable Developmental Goals. So if you want to achieve this Sustainable Developmental Goals target of child mortality reduction, we have to eradicate malnutrition and its morbidities at any cost. So this is the one of the prime focus of our government, and all the leading academic institutes and research institutes how to integrate ourselves, how to develop and eradicate this very grave situation. So let us understand what is the consequences of malnutrition. If you see, there are various consequences of malnutrition, but what the most research studies are showing, that when there is maternal malnutrition in form of whether it is undernutrition or overnutrition, what it causes, it changes the microbiome of the maternal side, and resulting microbiome disturbances in the neonate or the fetus, which results in abnormal immune response, abnormal metabolites, abnormality in hypothalamic pituitary axis, and which in a longer run leads to various types of neurocognitive abnormalities in form of poor cognition, poor learning and memory, increased incidence of anxiety and depression, poor axonal outgrowth, synaptogenesis, neuronal proliferations and myelination. So a long-term effect is that there is poor neurodevelopmental issues. Similarly, some paper shows that the early malnutrition, that is first 1000 days of life, if the malnutrition is there, it leads to coronary artery disease, diabetes mellitus, various types of pulmonary disease. So in this figure, you can see this is an graphical abstract of a reputed recently published journal. So it shows that if there is a malnutrition is there in early malnutrition, so it leads to intestinal dysbiosis, and which leads to increased intestinal permeability, and this leads to various types of cardiac as well as pulmonary abnormalities. So in long term, the malnutrition, early malnutrition, leads to a variety of neurocognitive, cardiovascular, metabolic derangements in the body of the adult population. So the early care for these children is very much essential if you want to really prevent the consequences of malnutrition. So this is another graphical abstract. You see, if there is a maternal malnutrition, often it leads to IUGR, lactational failure, stunting, wasting, underweight, impaired cognitive development, obesity, type 2 diabetes, hypertension, and cardiovascular disease. So there is a lot of consequences. Apart from this, malnutrition leads to immune dysfunctions. Clinically, we also find that malnourished children suffer from a lot of morbidities, comorbidities. So there is a serious immune dysfunction. Sometimes it remains subclinical, sometimes it is evident clinically, but there is immune dysfunction in every case of malnutrition. So why should we deal with this nutrition or malnutrition? Because if we treat malnutrition at an early age, if we treat it rapidly, we prevent it, we benefit to the give benefit to the individual, and in long run benefit to the family, benefit to the community, and at last benefit to the nation. So early eradication, early screening, early management of malnutrition is very essential. So presently, all the focus is on severe acute malnutrition. But the real issue behind this eradication is basically the mild to moderate form of malnutrition. And for the effective management of mild to moderate malnutrition, we require a multi-sectorial approach. We require social protection, agriculture, poverty reduction, education, women's empowerment, as well as health. And the Ayush sector has particularly the advantage being the working at the grassroots level of the society. We have an added advantage to really manage these conditions of malnutrition, which is grade 1, grade 2 malnutrition, and even uncomplicated type of grade 3 malnutrition. So what is the Ayurveda model of managing the childhood malnutrition? So basically, there are 17 components of the Ayush nutritional plan. From the policy perspectives, you can see. So first is the situation analysis of the nutrition context, planned priority actions, multi-sector and multi-stakeholder involvement with a clear-cut financial framework, operational framework, monitoring and operational research, documentation, dissemination of good practices and lessons. So how these things policy actually translates into the clinical features. So how clinically we can manage condition of malnutrition. So in Ayurveda text, there are a lot of diseases and symptoms which are mentioned in form of balsos, parigarbhic, fakroga, karshya, even in many other diseases also karshya or the dorbalya, these features have been mentioned. But practically how to apply this knowledge and whether it there we can develop a simple algorithm, easier algorithm by which you can manage these cases. So this is a basic algorithm based on the latest recommendations. So any child presenting with Karshyata, so we have to initially try as that. So look for Shoth. If there is an edema, so the line of management is different. If there is no edema and the baby is clinically well alert with a good appetite, and this if you can calculate the Z score using a WHO Anthro software, if it lies between -2 to -3, so it is a case of mild to moderate uncomplicated type of malnutrition, which can be easily managed by the supplementary foods, home based management and some OPD visits. So this is the first part of the malnutrition algorithm. So if there is presence of edema and the score is above -3, but the child is clinically well alert with a good appetite, it is severe form of malnutrition, but it is uncomplicated. Still then it can be managed at the OPD level. But if the score is -3 and there is presence of any one of the features with this -3 score, that is the baby is drowsy or hypothermic, there is high grade fever, severe dehydration, so it is a case of severe acute complicated type of malnutrition, and it cannot be managed at OPD basis or a home based management. It has to be done in a IPD based scenarios. So basically the triage is based on presence of edema, Z score, whether appetite is good or not, and the baby or the child is alert or not. On the basis of that, there are three cadres: mild to moderate, severe uncomplicated and complicated. If you see the IAP classification, so grade 1, grade 2 will fall in this category, grade 3 and this one will be in grade 4. So after that, if you want to basically OPD based management or IPD based management, so any child with Karshyata, we have to clinically evaluate the child, take a nutritional assessment and anthropometric assessments. So after these three things, for nutritional assessment, I will discuss about few softwares which are available, and it is very good to use them because we are getting a very good results of these softwares in assessing the nutritional status and often nutritional counseling. So after these three things, assess whether the child has a Samavastha or a Niramavastha. So if the child is in Samavastha, the initial management is Dipan Pachan. So Dipan Pachan may be from simple medication or from a compound formulation. You choose accordingly the prakriti and the condition of the child. So after Dipan Pachan, if the child is in Niram Avastha, there is no association of Ama. So you go for Kosht Shuddhi. After Kosht Shuddhi, the Kosht Shuddhi may be done with a mild Virechak, maybe Avipatik or Aragvat. Then lead further after Kosht Shuddhi, Krimagna Chikitsa, and after Krimagna Chikitsa, administration of Santarpana Chikitsa. So one of the error what clinician is doing is that they, without giving Dipan Pachan or Kosht Shuddhi, if you apply the Santarpana Chikitsa, it will enhance the Samavastha. So gradually Kosht Shuddhi, Krimagna Chikitsa, then administration of Santarpana Chikitsa, and for a long run, for Apunarva Chikitsa as well as to support the dhatus, administration of Rasayan Yogas can be done. So Rasayan Yogas can maybe a simple herbal formulation, or maybe a Swarnaprashan, or it may be a other some formulation, polyherbal formulation or herbomineral formulation as per the condition. So apart from this chart, you have to also consider if the baby is taking maternal milk or the breast milk feeding is there. So if you are suspecting maternal stanyadushti, yes. If yes, assess for the maternal sama and niramavastha. If samavastha is there, go for dipana pachana till the agni shandukshana is there. Then go for kost shuddhi. And if the niramavastha is there, then directly kost shuddhi can be given and mridu shodhan can be given. And after that, Samanya Stanya Shuddhi Yog, if you suspect the maternal Stanya Dushti, because many of the Stanya Dushti leads to malnutrition, like virus Stanya Dushti. So if you clinically suspecting that this is a Stanya Dushti is there, so go for a Samanya Stanya Shuddhi Yoga, like Sunthi Churna or Pathadya Churna or Dashamula Kvat. Or if you can go for a Visishta Stanya Dushti Shuddhi Yoga, like if you Vatika Stanya Dushti or Pathik you're suspecting, so accordingly you can choose the formulation and give the formulations. And many of these Balshos or undernutrition children often have comorbidities. If they have comorbidities like Arochak, Pratishay, Jwara, Kasa, Grahani Dushti, Pandu, sometimes even Dantodbhavajanya Vyadhis are also there. So you can manage as per the protocol of the individual disease along with this Karsheta algorithm. So in the assessment of the Sama and Nirama, so Agni status assessment should be done. So as you know that most of the children either have Tikshna Agni or Mandagni. So as per this Chardi, Sada, Praseka, Siro Gauravam, Jathara Gauravam, Adhman, Shula, Jathara Gauravam, Pravahana, Atisar, Antrakujan. Accordingly, you choose the medications. So which type of medications can be used for Dipanapachana. So if the comorbidities is like mainly the comorbidities in undernutrition will be related to upper respiratory tract and GI tract infections. So accordingly, if there is Jwara patient is there with Karshata, to manage accordingly as per our classical management. For management of dehydration, we can administer Sadangapaniya and very common medications for Vata predominant fever, Pitta predominant or Kapha predominant. Accordingly, you can choose as per your convenience. This is merely an example to make you learn that we can classify and assess and classify and manage accordingly. Similarly, if there is Urdhajatrugat Vikar is there, Kasa, Pratishay, so if accordingly Doshak predominance, you can use common medications which are Vyadhi Pratyanik, Dosha Pratyanik as well as Rasayana like Sitopladi, Agastya Haritaki, Vasavaleha after the Agni Shandukshana. Similarly, a few recommendations are there which will very much recommended to do because these concepts are gradually we are forgetting these concepts, but if we can take care of these concepts, we can adopt these concepts, definitely we can manage malnutrition very well. One of these concepts is Garvini Paricharya, that is Ayurvedic prenatal care, including Masanumasik Pathya, use of Garbhastapak Dravyas, and avoiding Garbha Upghat Prabhavas. So if we can decrease the incidence of prematurity or intrauterine growth retardation by enhancing the nutritional quality of the mother, so we can definitely improve the hazards of malnutrition at the postnatal age and early childhood. Similarly, the care of lactating mother, simple medications like Shatavari, Vidarikand, these are the few medications which should be now provided at every village level, community level, so that the nutritional care of the lactating mother can be taken care of. Similarly, the concept of Stanya Shodhan and Stanya Janan should be revitalized like Patha, Shunthi, Dashamula. These are the some common Stanya Shodhak Gana which can be used in mothers. And another important aspect is early recognition and management of malnutrition through Ayurveda interventions. So early recognition is very vital in case of malnutrition management because delay in recognizing or screening will shift a baby or a child from grade 1, grade 2 malnutrition to a complicated form of malnutrition. So after Agnidipan Chikitsa, common single herbal formulations like Ashwagandha, Balamul, Amlaki Churn, polyherbal formulations like Samvardhan Grit, Arvindasav, these are very good. Punarnavadi Mandur, which also take care of the malnutrition as well as anemia also. So these are the common formulation. After early recognition at a very early stage, we can give this for prevention of prevention and management of malnutrition. Another important aspect is promoting traditional Abhyanga procedures. Like many of the metro cities, we have now forgotten the importance of Abhyanga. So common coconut oil massage, sesame oil massage, even medicated Bala Ashwagandha, Chandan Bala Lakshadi Tel. These are the some of the oil massage which are very effective in improving the body bulk as well as the strength of the baby, as well as the vitamin D deficiency is also being taken care of. So there are many research papers which shows that the beneficial effects of this Abhyanga on newborn as well as in children. So apart from this per se management of undernutrition, early management of childhood morbidities are also required through Ayush interventions, which can be easily taken care of at the community level, like GI tract infections, pratishyay, kaswas, very common medication, but really very effective in managing childhood morbidities. Because childhood morbidities often, if not taken care of, often lead to malnutrition, and malnutrition often leads to childhood morbidities. So it is a vicious cycle. So common medications at an early stage, early management will definitely help. Then promoting Ayurveda therapeutic foods. So in case of, there are many types of therapeutic fruits mentioned in our Samhitas, particularly in Kashyapa Samhita, Falajusha, Patrayusha, Pushpayusha, Lajamanda, Yavasattu, Khajuradi Mantra. There are various types of nutritious recipes which have been mentioned in our text. We can take care of, we can advise these dietary supplements in managing as a pathya in common morbidities also. So concept of millets, we have to reintroduce the concepts of millets. Fortunately, it's International Year of Millets in 2023 declared by, recently it was declared. And these millets, common millets, which are very nutritious and which can easily, it was taken by the traditionally in the local villages also. So we can reintroduce these millets in our diets that the children, so that the undernutrition problem can be tackled at a local level also. So exploring the potential of local foods. So there are very traditional foods which are mentioned, which are used, but gradually we are using less of these traditional foods. But these are socially, culturally, and economically very important, as well as these are very nutritious. For example, in North India, you can find Goom ke laddu. In Kerala, there is Therali appam, and even in all the states, we have very nutritious recipes, which are very good for managing these conditions of malnutrition. Utilizing Ayush manpower. We have 10 lakh Ayush physicians across the country. We have trained manpower, and we can play a key role in managing this malnutrition. So apart from this, we have private practitioners, many Ayush dispensaries, Ayush medical college. So we can integratively work and eradicate this type of malnutrition from our society. Another is revitalizing the concepts of Phalaprasan Sanskar and Annaprasan Sanskar. So if we can really popularize this concept once again, so the timely introduction of complementary food, that is 6 months, we can also have an impact on the community level also. Then preventing adolescent anemia. We know that anemia is an important comorbidity of undernutrition, and many of the adolescent girls, they suffer from anemia, and in future they will suffer from undernutrition, and consequently they have IUGR or preterm birth, leading to a increased incidence of malnutrition. So we have to take care of these adolescent girls for anemia. So there are in many states there is rituals of there is festive season when there is to celebrate the onset of menstrual cycle. So these type of customs which are now been forgotten can be revived back. Like in Tamil Nadu, in Odisha, so they give amaranth seeds in a cup of raw milk on the first day of period. So these are the some rituals. There were some festive traditional practices which are very much important and which were very much relevant in managing under nutritional deficiencies and anemia in adolescent girls. Another important concept is food fortification. Bhojanagre sadapatyam, lavanadraga sevanam, or addition of trikatu or panchakol in the diet not only increases the taste of the food, but also it increases the bioavailability of the nutrients. So we can prescribe this formulation frequently. Another concept is revitalizing concept of dhatri. If Ministry of Health and Family Welfare can thought of an asha and it can introduced in the community health setup, why not concept of dhatri can be introduced in Ayush sector? So these dhatri will be responsible for taking care of nutritional aspects of the newborn, starting from traditional massage to antenatal care. So the revitalizing concept of dhatri will be a good initiative considering the increased incidence of malnutrition. Similarly, school and community nutri gardens. So this concept is also very interesting, and in many countries it has been already been started. It is an opportunity for the children also to learn about various types of medicinal plants, and it's also an environmental friendly concept, cost effective, and there is most important part is that community participates in these type of activities and they learn a lot about diet diversity and food security. So we are also thankful to Ministry of Ayush that they released an Ayush diet advisory for POSHAN Mukt Bharat. I will request all the students to once go through this Ayush diet advisory. They have special dietary recommendations for children starting from newborn period to toddler to adolescents. So a few studies I would like to discuss here in this point, that we established one Ayur informatics lab at our department, and we because we felt that the comorbidities of the malnutrition, there were two comorbidities. So we can, if we can through a computational analysis, so we started one study. Study is titled as Network Pharmacology Based Immunity Enhancing and Pulmonary Protection Activity of Syrup Bal Ayush Quath. So recently the Ministry of Ayush launched a Bal Raksha kit. One of the ingredients was Ayush Bal Quath. We converted that Bal Ayush Quath into a syrup. It contained ingredients like tulsi, dalchini, shunthi, haridra, and draksha. So these were the 5 ingredients, and we prepared the drug from IMPCL, and we sent the sample for the quality assurance and for HRLCMS at IIT Mumbai. And these are the results of the HRLCMS of this Bal Ayush Quath. So after this, we identify the bioactives present in that syrup, and we transfer this data into the simplified molecular input line entry system, and we screened for whether these bioactives are having human gastrointestinal absorption capacity or not. And we calculated the drug likeness by Swiss ADMA software. So after that, we got bioactives first, then we searched for whether they are suitable for human GI absorption, and we calculated the drug likeness. After that, we took the data into the Swiss target prediction so that the target of the identified compounds can be predicted. So this software actually estimates the most probable micromolecular targets of the small molecules or the bioactives. So we found, and only this target having probability more than 70% were only selected. So after that, we chose only those bioactives with good bioavailability. So in the results, we found that in the syrup, we found 100 active 110 botanicals which were identified. And after the ADMA screening, absorption, distribution, metabolism, excretion screening, and the drug likeness, 44 compounds were qualified through the predefined criteria. Out of these 44 active compounds, smiles were plotted into the Swiss target prediction to obtain the potential targets of each compound, and 109 compounds were collected, and after removing the duplicates we found a total of 62 targets which were finalized. So in the gene card database, it is a database which integrates all annotated and predicted genes associated with human disease. So we found targets for immunity enhancing activity as well as those genes which provides pulmonary protection. And we found that about 1341 targets are there which have immunity enhancing activity, and about 1158 targets which have pulmonary protection activity. And we further analyzed that there are about 20 overlapping gene targets for immunity enhancing activity, and there are about 24 overlapping genes target for the pulmonary protection related targets. So after getting these targets, we constructed a network analysis using Cytoscape 3.9.1. And we found that genistein, luteolin, and camphorol, these are the top three ingredients linked to carbonic anhydrase 2, and these were the crucial targets for the syrup for immunity enhancing activity. So these were the three bioactives we found. And this was the network of the bioactives from syrup Ayush Balquat with immunity enhancing targets. Similarly, when we analyzed the pulmonary protection capacity of that syrup, we found that luteolin, camphorol, genistein, and 4-hydroxycinnamic acid, these were the top ingredients which were related to the immunity enhancing activity. And we constructed a network pharmacology chart. And further we went for gene ontology and cake pathway analysis, and we found that basically the immunity enhancing activity as well as the pulmonary protection activity of this syrup or the trial drug is due to the estrogen signaling pathway and endocrine resistance. Further, we are planning for a clinical trial on that. But however, the clinical observation says on 700 children we have observed that there is an improvement in appetite, there is reduction in mean incidence of respiratory illness, and the frequency of constipation is greatly reduced. So these are the basically clinical observation we found with syrup Bal Raksha Quat. And we are planning a study with an objective to enhance the Vyadhikshamata of children through Bal Raksha kit. And the primary outcome measures is morbidity incidence reduction, and our secondary outcome measures will be changes of natural killer cell activity, changes in cytokine level, as well as improvement in anthropometric measures. So at this juncture, also like to discuss if recently we conducted a study on the effectiveness of Krishna Di Lehe and dietary counseling in the management of childhood Karsha, that is grade 1 and 2 malnutrition, and open label double arm randomized clinical trial. So the children with childhood Karsha grade 1, grade 2, we randomized into two groups. One is we gave Krishna Di Lehe with standard dietary counseling, and in group B, only standard dietary counseling was provided and intervention was given, follow up after 90 days. So 30 patients were in each group. So these were the eligibility criteria, inclusion and exclusion criteria, and these were the criteria for assessment. And this is the Krishna Di Lehe has been described in the Chakradatta text. It contains Ashwagandha, Pipali, Madhu, Grita, and Sita. So this is a very common and very easily affordable formulation. And we found that so the dietary counseling, these are the in consultation with the chief dietitian of Department of Swasthya. So we used for nutritional counseling is we used a DietSoft software, because many of the softwares which are available in the market have Western food recipes. So this DietSoft software, we found that it is a very good, robust type of software with all the type of Indian food recipes, and is very easy to use also. So we used DietSoft software as well as Anthro software for anthropometric assessment and documentation of the records. And for growth charts, we used IAP growth charts. We used basically a Android based app for it is prepared by the IAP growth charts only. So we found that comorbidities are greatly reduced, appetite is improved, and there is increased in weight in group A. Though it was not statistical significant as compared to group B, but definitely the quality of life of the patients improved, and we are planning for a long-term studies because none of the patients reported any ADR issues. Similarly, because Ministry of Ayush has been associated with Smart India Hackathon, it is a nationwide competition. So this year, we tried to develop a smartphone which can assist us for a 24-hour dietary recall. What was the idea is that if you can click a photograph, it can automatically calculate the calories as well as the Ayurvedic parameters of the food recipes like Rasa Guna Virivak. So many of the engineering colleges participated in this competition, and one team from Tamil Nadu agreed to develop this type of mobile application which can help us assessing the 24-hour dietary recall. So this is in a very preliminary stage, but in future we expect that we will have a full-fledged digital smartphone app which can help us in developing the SOP for the nutritional counseling on the basis of Ayurveda parameters. So there are few initiatives which are being conducted in our department at AIA. So public health initiative like Supraja, Project Vatsalya and other initiatives. So at the Department of Komarvitya, we have launched one Project Vatsalya which has multiple components. Stri and Prasuti Roga Department Project Supraja is going on for prevention of IUGR births, and various research activities like effect of Vidari Kandadi granules, Krishna di Avle, Karshya Harloho, Darva di Leho, and various types of regular community outreach programs, awareness programs we are conducting under this. So thank you very much. I acknowledge our director, Dr. Tanuja Manoj Nesri, my HOD, Dr. Rajgopal S., my colleague, Dr. Prashant Gupta, all my PG and PhD scholars, and my Panchakarma technician staffs of our department for making this success. I also thank Nisha Madam, Shrindi Sir, Rakesh Nagar Sir, Dr. B.D. Sharma, Dr. Vishal and team NIA for giving me this opportunity to talk with us. Thank you very much.
Thank you, sir, for your knowledge enriching keynotes. Due to some disturbance, there is a network problem. So, I am audible here?
Yes, you are audible.
Yes. Now, sir, some questions from our students. One or two questions I will raise here. For Prashant Gupta, sir, are you here? Prashant, sir? Okay. For Arun Boss, one of student, Dr. Anju KP, asked the question: the possible pathya can be prescribed to Garbhini and lactating mother to prevent malnutrition. I think lactating mother we can prescribe some things, and for Garbhini it is a part of gynae department. So, any suggestions for the lactating mother?
So, as per the Ayurveda classics are concerned, there is a detailed description of Masanumasik Paricharya is there. So basically, in Masanumasik Paricharya, if you summarize the things, it is basically milk and Madhura Dravyas. It is milk and Madhura Dravyas, which is Purna Satmya for the during antenatal period. So we can very much safely we can prescribe these common medications, common nutritious food during the antenatal period. During lactational period, so there is also this clear-cut description of what is pathya and apathya for during the lactation period. So with the nidan of this tanya dushti, ajirana, asatmya, viruddha, atyartha, bhojanat, lavana, amla, katukshara. So there is a clear-cut description of all the things which should be avoided during the lactational period, which may lead to stanyadushti, and it will directly also affect the growth of the baby, the quality of the milk. So all this can be, these are already described. As far as the medicines are concerned, common medications like Vidari Kandadi granules and Shatavari granules, so these are safely prescribed and we are getting very good results. We see that many of the patients are taking and they are getting very good results by these common medications. Only thing we have to take care that there is no ajirna and there is no amadushti. So we have to take care that Agni Sandukshana is there and Mrudu Kosta Shuddhi should be done. So that's the only thing which has to be taken care. Otherwise, there are many medications which are very effective.
Thank you, boss, for this nice answer. I think Dr. Anju KP got his answer. And the next question is for Prashant boss. I think there is a network problem with the Prashant boss. And next, sir, आप स्लाइड शो बॉस इसका एक बार हटा लीजिए. Thank you, boss. Very nice presentation, boss. Especially starting from the Garbhini Paricharya to the nutrition for the child, and especially management of severe acute malnutrition and use of millets. As Pradhan Mantri Shri Narendra Modi ji said, vocal for local, and good examples of food fortification was also there. And boss, you discussed about a study regarding Bal Raksha Kit in All India Institute of Ayurveda, New Delhi.
Yes, sir.
I think, boss, it should be multi-centric. If NIA and Jamnagar can contribute in this study, because we are also using this Bal Raksha Kit.
Yes,
Next.
it would be really nice. So we have also developed one Android app for data capturing.
Yes.
If this can be converted into a multi-centric trial, it will be very nice.
Yes, sir. And it is very nicely planned, and you described here. Lots of question, but in last of this webinar, I would like to call upon Dr. Rakesh Nagar, sir.
Dr. PD.
Yes, sir.
Some questions are sorting here, so it's necessary to ask the answer from the expert. One question from the Nitu Sena. She is asking for the which type of diet and Ayurveda medications can be given to type 1 diabetic malnourished child. Because in the nutritional kits there are lots of sugar. So which type of Ayurveda medications we can plan for type 1 diabetic malnourished child?
Yeah. So type 1 diabetes mellitus is basically a Sahaj type of prameya. So Sahaj type of prameya, we cannot give a lot of sugar and other carbohydrate things. So in this condition, the main objective is to treat the Dhatukshaya Avastha.
Yeah.
So in case of Dhatukshaya Avastha, without giving Santarpana, we have to treat the Dhatukshaya Avastha. So clinically what we are finding that in this condition, if we can go for Madhutalik type of basti and Abhyangan. So rather going for any type of Santarpana Jana Chikitsa, if we go for Basti Chikitsa, it is beneficial for the baby for treating this Dhatukshaya Avastha. And drugs like Shilajutyadi Loha, these are very much beneficial in these children. So rather going for malnutrition, we have to go for rather Dhatukshaya Janya Chikitsa. We have to focus on the Dhatukshaya Avastha. So in this condition, rather going from oral medication, we should go for Basti Chikitsa.
Basti Chikitsa and dietary modification. I
As
want to add
this protocol.
I want to add something in this. As you say, as you explain in your lecture, Yush and Mand.
Yes.
So we can also use Sanskarit Yush and Mand in the cases like this.
Yes, sir.
So
Go to
next,
Dr. BD.
Yes, sir. Thank you, sir. Again, I am inviting you for the vote of thanks. Sir, please.
Thanks, Dr. Bidi. Um, Let me explain, let me summarize the webinar lectures of both esteemed speakers. Dr. Prashant explain about the fact and data on malnutrition, involvement of different ministries to correct this problem, Ministry of Ayush and Ministry of Health and other ministries also. He also explained about the POSHAN Mukt Bharat and 5 rights: right time, right quantity, right quality, right method, and right place. He also explained about the nutritional benefits of moringa. We can use moringa in the form of laddu, cookies, dosa, and even in the chila form, like Indian dosa form. And now syrups also available in the market. And he also explained the benefit of swan passion in the malnutrition cases. And Dr. Arun Mahapatra complete the explain about the complete introduction and pathophysiology of the malnutrition, including garbhavastha and effect of maternal malnutrition on the fetus or on the child. Uh, he also explained about the malnutrition causes and malnutrition. He explained about the malnutrition causes, pathophysiology, and also the effect of malnutrition in the terms of failure to thrive, malnourishment, and even mental retardation also. In the management, he explained about the grade 1, 2, and 3. If patient taking accepting oral feeds, then we can plan the management rehabilitation, nutritional rehabilitation through the Ayurveda concept, like Deepan Pachan Chikitsa and other concept. We can use other concept. He in dietary modification, he explained mund and use of mund and use. And in the medicine, we can use Arvindasa and Ashwagandha Grat also, and even local application of oil, like in the Abhiyaan, also benefited in the malnutrition patients. And newer things he explained about development of software and development of Android application to collect the data and to create the awareness in the parents. So very thankful, thanks to both esteemed speakers. And here I am here to deliver a vote of thanks, official deliver to vote of thanks. So first of all, I am. We are very thankful to our patrons, Padma Shri Vaidya Rajesh Kotecha, Honorable Secretary of Ministry of Ayush, and Professor Sanjeev Sharma sir, Vice Chancellor of National Institute of Ayurveda. They both are very supportive and always encouraging to our department to do right, to do good thing in the right way. And sincere thanks to Dr. Nisha Oja, Head of the Department, Organizing Chairman of today's national webinar. And special thanks to organizing team organizer Dr. Srinidhi, Associate Professor of Department, and both coordinators, Dr. B.D. Sharma and Dr. Vishal. And sincere thanks to our scholars who supported in the every steps of in this webinar to organize adult free. And in the last, I am thankful to the listeners who passionately attend and participate this webinar and benefited from the author's concept. Thank you all.
We are finally we are very much thankful to our IT team who has are with us, and they are supporting us So thanks to IT team also.
Thank you, ma'am, for meeting me.
Sir. And last, it was really great experience to listen such impertinent yet ingenious personalities. A heartful gratitude for their tireless efforts to illustrate our knowledge, and a very big thanks to our organizing chairman, Dr. Nisha Oja Madam, to seeking possibilities in me and give me this opportunity to coordinate this webinar. Thanks to all audience for listening with patience. Thanks to all. Now you can leave this link. Thank you, all of you.
Thank you.
Thank you, madam.